Hello, everyone. Welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. And I have multiple guests with me today. I'm going to let them introduce themselves. We did rope Bryan into sitting in today to ask questions because, again, sometimes we don't know exactly what a man might want to know that we're not saying already. So it's always helpful to have input and questions organically from someone. So he had no choice. He was here and we made him do it. So Marissa, do you want to introduce yourself?
Hello, my name is Marissa Staten, and I'm the medical esthetician laser technician.
And Marissa doesn't do a lot of our sexual wellness, just so you know. So, she may be a little quiet during, but don't expect that from Faraday.
Hi, guys. My name is Faraday Golombieski. I'm the nurse practitioner at Revitalize, and we're here to talk about sexual wellness.
And I am Bryan. I actually have known Dr. Durst for quite some time now, and it's been amazing to learn almost every episode, helping her out with the videos and marketing, and guys, wealth of knowledge sitting at this table right here.
Aww. Well, we're gonna have fun with
He's
this
trying to
one.
butter us up.
Yeah.
Go easy on me, please.
He's getting us
please.
prepped, yes. Well, we're going to talk today about ED, or erectile dysfunction. And so, again, a topic that can be hard for men to open up about because, again, where do you go to have these conversations? I don't think they're having it with other men at parties, or on social events. Definitely not at the football games or tailgating. And then sometimes I think, again, it's something everyone knows in the bedroom. It's an objective, happening.
Can't hide it.
So you can't hide it.
No.
But then I think that's an uncomfortable conversation because the guy is, again, not happy about the situation. And then sometimes the significant other woman is taking that personally. And so that might not be in family is not another option. So again, at Revitalize, we do a lot of sexual wellness and we want men to feel comfortable having those conversations with us. And so we're going to go ahead and talk about erectile dysfunction today and, different things that might cause it. So
absolutely.
And what to do about it.
Yep. Even before we started recording, I was asking Bryan, do you and your friends talk about this? And
Absolutely not. I know that this day and age, we obviously should be talking about things as much as possible, getting it off our chest. I don't know, just, therapeutic to a certain degree. But if I was sitting there watching football with you and you were my guy friend, and you just looked over me and said, like, bro, I can't get it up, I'm probably going to take a sip out of my beer and be like, what'd you say?
You're going to laugh at him?
I don't think I want to have that conversation with you right now. So, yeah, it's something we definitely do not do. It's just, I don't know. I definitely will say, even just for me personally, I'm not trying to justify it, but I come from an area in a background where it's just macho men. You got to beat your chest and, you don't talk about your weaknesses at all. So that weakness, that's the last thing you would ever bring up.
And I think that's actually very common with men because, I think men are definitely much more competitive. That's like
Absolutely.
Part of their nature is to compete with themselves, with each other. That's part of bonding for men. Women aren't
Absolutely.
like that necessarily. There's exceptions and, ages.
But we talk about it all.
But we talk about sex and
regularly.
And in detail, just so you know. And
all the things, guys.
all the things. Women talk for sure. And they're talking to their friends. Their friends are sharing their stories. And we're talking details. And that's common. So that is something that doesn't happen with men. But again, we get into detail when you come into the office and we want you to feel comfortable doing that. I think the most important thing, and we'll open the conversation with that, is it's common. It is absolutely common. A third of men are experiencing erectile changes in some way. And so that conversation might be hard initially, but our office is a very different atmosphere. Everyone's so friendly, approachable, helpful.
Yeah. It's open.
It's open.
You can be an open book with us. We're not going to judge you. We're not going to be like Bryan. We're not going to make fun of you.
None of the above. And again, it's common. It's almost a badge of honor to be, in my opinion, for a man to take control and take charge of something he wants to see done better, or he wants to optimize his performance. And the fact that he actually looks for solutions and pursues them, in my opinion, is, something you should be proud of instead.
Exactly. And like Dr. Durst said, 1/3 of men suffer from erectile dysfunction. But as we age, right, as guys age, it's more likely. About 40%, 50%. So, pretty significant decline as we age, but it's also for younger guys too. There was a study recently at the Journal of Sexual Medicine that said men 40 years and younger, 26% of them are still experiencing erectile dysfunction. So it's happening in the younger guys too. So if you're younger and you're having issues, don't think that it's abnormal or it's just you, because it's young guys too. It's not just the old guy with the blue pill. All men experience it at different stages of life, and that could be there's many reasons that can cause that, many different comorbidities, blood flow, hormonal, whatever it may be, and that's why you come see us. It's our job to figure it out.
Fair enough. Now, so that is one thing that if in a conversation has come up that guys will talk about, they'll admit they're taking little blue diamonds, so they can be ready, but that's about as far as the conversation still does go. That is it.
And I think that, again, it has become more talked about, on TV, on the radio, and on social media. And so that's why people are more comfortable talking. It's like Botox years ago. Nobody would say they had Botox, and then now everyone talks about Botox. Same thing with the little blue pill, because, again, it'll help you maintain or get a harder erection. And so that's okay. It's the point of like needing the blue pill is what we're talking about, so that we can help. And there's lots of solutions that we have for that. But again, it's more common. It's more common than you think. And again, even after the age of 18, because I know, men, you guys are not going to want to hear this, but peak performance is in the late teens for a man. And so again, when we're talking about, that significant percent, and you said what in the sexual medicine?
26%.
Under 40.
Under 40.
And that really starts above, because there was another study way back that had done one where it was 13% of men above 18. So it starts young. And so peak performance is in the teens. And then after, when you start to notice some functional changes, some of those might be, and again, we can kind of go through. Drive obviously is one issue, right? And so you might be noticing that you don't have the sex drive you did, and some things that might. What's the big thing that changes sex drive?
Oh, testosterone.
So
low testosterone.
Yeah, you're basically, when you're talking about drive, you're talking about hormone, and that's testosterone. So low testosterone or meds. Essentially, that's what I kind of look at. Yes, there's some psychiatric, or psychological issues, but honestly, way back when erectile dysfunction was starting to be, discussed and looked at, they thought there was an element of, but like a
mental health component.
Psychology, of men that played something in. But really, it's low testosterone and it's meds. There are some, conditions, maybe anxiety or depression, that might cause it. But again, more likely you're on medicines that are causing it.
Those medicines libido we're talking about specifically.
Libido and sex drive, yeah.
Other issues that other comorbidities can play into erectile dysfunction. Obesity is huge. That's a big one. Inactivity, diabetes, hypertension, high cholesterol. So we have all these other health issues that can also contribute to it. But with libido, usually it is more hormonal.
So there's the hormone aspect, and that's just drive in general. So if we're talking about, that's like a hypoactive, technically the term is hypoactive sexual desire disorder, if you were to medically term that, but that's low drive, low libido. And then you can have, again, ED, which is more of a local blood flow, function change and issue. But you're right, diabetes alone puts you at a high increased risk. And if you have diabetes and erectile dysfunction, there's some studies that also show that you're more likely to have heart blockages and have sudden heart attacks and even sudden death. So if you're a diabetic with erectile dysfunction, that's definitely something. It's almost a barometer of vascular health because
absolutely, cardiovascular disease is another huge comorbidity.
Huge. And so if we were to make it simple, we not frequently, what we say is 80% of it is a blood flow issue, 20% of it is hormonal. And when we're talking about blood flow, that's what we're talking about. If you have high blood pressure, if you have high cholesterol, if you have diabetes, all of that causes cardiovascular issues and your blood vessels aren't as healthy and you don't have a healthy flow to the penis like you did.
Yeah.
So,
metabolic syndrome fits into all of that. That might be a term. Some of you guys that it clicks for you, your doctor may have said that, and that just is a grouping of all of these different, some of these disorders.
And really, means, again, high blood pressure, like increased abdominal girth, high blood pressure, abnormal lipid panels, increased insulin resistance, all those, and it's lumped into everything. Again, medications if you're on it, that kind of stuff. But really it comes down to us, blood flow and hormones. And we're going to talk at the end of this a little bit more about hormones and all the different ones, because it's not just testosterone. It's more than that.
It's so much more. We got to look at the pathways, right? So testosterone ultimately initially comes from cholesterol. So then when we look at cholesterol and how cholesterol then breaks down the pathway, a lot of clinics are missing so much by just doing testosterone. At Revitalize, we want to treat the whole person and we want to fix every step that we can. So we need to go to the beginning of the pathway and fix what we can along that way or optimize it to make you feel better all around and not just treat one portion.
Yeah, no, you got to look at all the points, get all the data points and treat them. And so what are some changes you might be experiencing? Again, common, a third of men, and there's studies like way back, there was a study in JAMA in 1999 that showed 31% of men with erectile changes. So these are studies that have said this. And again, a lot of men not aware that there is actually a diagnosis, even though they have the symptoms. So if they're asked the questions and they check it off, they have some changes, which would be erectile changes or ED. I like to say erectile changes can be from mild to more severe. So we just have more improvement to make if it's severe and less otherwise. But some of the things, you might have prolonged period of time until you get an erection. That's one of the things that you might be experiencing. Prolonged time to orgasm.
Inability. I have guys that come in and say, no matter what I do, I can't get off.
Yeah. Yeah.
So that's an issue too in itself. Not just, we think of ED or erectile dysfunction or changes and we think, the guys can't get it up. Yeah. But it's not just about getting it up. It's about getting it up, keeping it up, and then being able to finish.
Yeah. Yeah.
Tell me this then, because obviously we already talked about it. We don't talk about it. Yeah. Men are just not going to talk about it. You guys know Alan, my best buddy, no, I'm not going to talk to him about it. But how does that go for you guys in the office in the consultation? Is the guy just pouring it all out? Is he shaking in his boots a little bit, trying to just whisper it out a little bit? This is what's happening to me? Or
that's funny. It depends on the guy. Some guys, they come in, we already know what they're there for, right? And they've already filled out a wellness form. They've already answered questions, hopefully, if they filled out the paperwork, right? Questions about their sexual health and what they want to see improve, what they don't like, what they're there for. So we kind of already know why they're coming in to see us. So, and we still ask them, why are we here? Some guys get real nervous and real awkward. Yeah. Well, I'm here, I'm having some, issues. And sometimes it is us going, okay, are you having erection issues? Are you unable to get an erection? Are you able to maintain? We can kind of ask some questions, some open-ended questions to get the conversation flowing. But once that conversation flows and it's an easy conversation, I'm not your buddy. I'm not going to make fun of you. We're going to talk about it and have a normal conversation using the words that you're comfortable using, whatever that may be. We don't have to say, oh, your penis, it might be, oh, my dick's not working. Yeah. Okay. Yeah. Let's talk about it. And it's just, that's how the conversation goes. And it's open, and when we're able to use that dialogue, eventually men get more comfortable talking about it. Every once in a while we get that guy that's real holed up in his corner, like still real nervous the whole time.
That's what I imagine some guys would be like that. But
that's not the norm. That's the rare guy that's still uncomfortable.
I think that's the exception for sure. And I think that again, they know there's an issue that brought him in and there's solutions and they're comfortable talking about it. We're very open about it. I mean, again, you've seen, getting it up, getting off, like all of the above, speaking your language, speaking to a man in his terms helps, get him comfortable, because again, these are conversations we have with women too, with women's sexual health. And, so we're very open about all of that.
And for you guys, you can't hide it. If there's a problem in the bedroom with you all, it's there. Can't Everybody knows. Women can hide it. We can fake it, honey, and you'd never have an idea.
Or something.
Yeah.
We can't do anything else.
Men, there's no faking it for men. Yeah. It's up or it's not.
Yeah, it's just not happening. Yeah, for sure.
It's an objective thing for sure. Like everybody else is aware. And
so when you guys come in, you're at that point, right? So, and I think that's a lot of it too, is that you know that nothing's going to change. So it's time to seek help, whatever that may be, whether that is helping with some of the blood flow issues, whether that's optimizing hormones, whether that's supplementation, whatever that option may be that the guy needs, exploring that and having a conversation about it.
Well, you guys are already educating me, because I can just tell you honestly, even as far as when I think of ED, it's just that purely, it's just not getting up. But, it's not even, it's also, like you just said, not getting off. That's also other parts of it.
So even orgasmic strength. So, they're ejaculating, they're not ejaculating as much as they used to, which will bother men.
Absolutely.
So, if your volume, with...
It's not what you think it should be. We hear about it.
Is not what it should be, then we hear about it. We hear about testicular size too, which, so men will have things that bother them, but strength of orgasm. Yeah. So if they're not feeling it like they used to, that's a huge thing. Even though they're able to, perform and come to an orgasm,
they're just not into it as much because they're not getting that reward, right?
Yeah.
Because that's what everyone's having sex for, is the reward at the end.
Absolutely.
Right?
Yeah. Exactly. Not here for just a high five.
Exactly.
Everybody wants. So I think another thing, though, to that point that doesn't get talked about enough is one of the things that changes with age is like a prolonged what we call plateau phase. So where you're having sex, and again, now all of a sudden men, as they get older, need more stimulation. So more tactile, more touching during, more constant contact. Sometimes maybe not having the woman on top because it's not, the right, contact for them, or even just visual, more visual stuff. So I think as things change, couples, again, the woman might take that personally if all of a sudden, he's not coming as fast, or he loses an erection during.
Yeah,
absolutely.
And again, it's because with time, not only our hormones, but blood flow is changing. And so you're going to notice subtle changes. So I say it's a badge of honor. And I think
we applaud you guys that come in.
Applaud every man that comes in when even they notice, because a lot of our men aren't noticing huge changes, but they're noticing some. Yeah. And that's the time to get on top of it.
Sensitivity is changing. They're needing more stimulation, visual or tactile, whatever it may be. And they're wanting to improve. Right. Just last week I had a guy, I'm good. He's like, I really am, but things are, sensitivity is not there anymore. I'm working a little bit harder, but everything's working. What can I do? Okay. Well, now we're just trying to optimize and work on it before it becomes a problem, right? Because we let it go, we make an excuse. Maybe I had one too many drinks. That girl wasn't that great looking. Maybe it was that, whatever that excuse is in our head. God, I'm stressed out.
That's easily what we'll
the
do.
family.
We'll pass the blame for something else, for sure.
You pass for those one-offs, and then those one-offs become every time. And now it's a bigger problem, and we have way more that we have to do to catch you back up. So to do it early and step up and say, okay, I'm seeing these changes. That repair is a lot easier on our end. And for you guys to see that improvement to continue and maintain healthy blood flow and hormones on the front end versus waiting until you're a train wreck. Yeah. And we do those too, but
it's a pile of chaos.
It's a pile of, that's lovely. A pile of chaos. I like that.
I agree. I would definitely say, I mean, now being 35, I think about my health versus 25. I didn't give a damn at that point. I even told you, Dee Dee, before, like, kind of just have like a white coat syndrome, if you will. I didn't go to the doctors. I didn't want to get checked out or anything. I just kept moving. But now, I got too much on the line. Like, I need to take care of myself. That's why I'm going to come get some blood work and stuff done with you, because I gotta take care of myself. But even those types of things, I may not be, transparent with a good friend of mine, but if I'm going to come somewhere, I'm going to talk to you guys about what's really going on. That's what I would do.
That's so important. Again, I always just say when they're here, I'm like, you got to just be straight up and tell me everything. Like, if you don't tell me, then we can't fix it.
Well, it seems like all the time, right?
We'll have fix it. Honestly, if we don't know exactly where you're at.
About, for sure. I understand.
And it's been on both ends, honestly. So we have seen like both ends, like where you half fix it and then you realize, or some people it's like, I haven't seen much in the way of improvement. So we kind of add an intervention, and that intervention isn't the right intervention because we're not going to get into detail, because again, they have more function than they're actually saying. So again, I think straight up, that's what we do a scoring system. So it's like the International Index of Erectile Function, or shortened, we just call it a SHIM score. Yeah. And again, we're a GainsWave provider. GainsWave is a network of providers that does protocols to address erectile changes. And so, we base it on a scoring system. And so we do the SHIM score. And basically you're looking at, again, can you actually get an erection? Yeah. Can you maintain an erection? Can you maintain it to
satisfaction?
Satisfaction is the last to orgasm. Yeah. And then how satisfied too are you?
Exactly.
You're right, because the end game is to have an orgasm.
Are you happy with what's going on? Because you might go, I get an erection. I maintain it. I'm getting off. But no, I'm not happy with the whole process from beginning to end. It's not what it was.
Correct. And so any of those that are changes, and the scoring is between 5 and 25. 5, you have severe changes going on. And 25, you don't have any. And it's not like we don't do things for men with scores of 25 that, again, like sensitivity has changed for them, something mild, or, they're just seeking better performance. And again, it varies. We may not add GainsWave. We might be talking about a P-shot, not GainsWave 2, but it does depend on that scoring system. It gives us a good objective, or peptides, or IV therapy,
or supplements.
Yeah, exactly.
I mean, the list kind of keeps going. Yeah. So it's not necessarily just a one and done.
No. And that's the big thing. Like, we want to stress that we're very comprehensive in our approach to sexual wellness for men, for women, and erectile dysfunction or changes. We're comprehensive. So it's not a one and done. It's not a one size fits all. There are multiple things we can do. It doesn't just include a P-shot and GainsWave and hormones. There's lots of other things. Those are just.
But if you're interested in hearing about that, we've done a podcast on GainsWave and P-shot. Feel free to look it up and comment, ask us questions. We've done a podcast on it.
Ask any questions.
There we go.
Yeah,
definitely.
She's click back to that before the end. I like it. Yeah, I'm going to put her on the end from now on.
There you
go. She's going to be at the end reminding everyone. But definitely comment if there's anything else you guys specifically want to know about. And maybe we'll talk about it during this podcast, and it'll be a question that, comes up. Then just send us a comment. Definitely share. You don't have to have the conversations with your friends, but you can definitely share this with your friends.
Yeah.
That's for sure.
There's a lot of
sharing
education.
Is caring. You should write this video to others for sure. So
that's it.
And we care a lot.
Yeah, exactly.
So on that note, and we'll continue to do more podcasts on sexual wellness. So we'll go into podcasts talking about supplements and peptides and lots of information on our channel, definitely. And we'll continue bringing you guys information that you want to hear about.
And I've been educated. I mean, I'm already learning more. Again, I was one mindset thinking if it's just not up, okay, ED. That's all it was. But there's
I think
more.
We really wanted to stress the fact that it's very common, and it can be mild. So if you're noticing any mild changes, that is erectile changes or mild erectile dysfunction. I don't even like to use the term dysfunction. I like to use
Sounds so
changes
terrible.
because it sounds, and
It
if
doesn't
it's
sound
severe, you
great.
have severe erectile dysfunction. No one wants to hear that. Instead, we have severe erectile changes, or we have mild ones. Let's get on top of it and let's talk about that. And, there's multiple things. Again, our major players, gains wave, acoustic shock wave, we base everything on our scoring system for those major players. Yeah. And, a P-shot, we can add stem cell and exosomes to that. And again, that's 80% of it is a blood flow issue, which is that. We're talking about, we even have a combination PD5 inhibitor, troche or pill. Troche means it kind of goes underneath the tongue and dissolves, but you can tell them about that. That's
It's
one thing we might add.
Viagra Cialis combo.
Yeah.
The best of both worlds, right? So usually guys take the little blue pill, right? Typically that's Viagra, and you have to take high doses, but those high doses can cause headaches, flushing, stuff like that. You hear a lot of guys say, I've had all these negative side effects, so I take a lower dose. And there's lots of them. Yeah, and there's lots of them. And so I have to take a lower dose, but the lower dose doesn't work that great for me, right? Cialis is typically dosed a little bit lower, but maybe you don't get the punch that you need from the Viagra. But Cialis is a 36 window versus a 4 to 6, so you get some residual effects the next day, which is nice. So with the combo pill, you get the best of both worlds. You get a low-dose Viagra, low-dose Cialis. We put them together. Well, we don't. The pharmacy does, and they're fantastic.
We have not had a man that hasn't loved.
They love them.
It is a local pharmacy that we use that was just ingenious and like putting this combo together. Yeah. And it is a low dose of each, and so you get the short
and
quicker, and you get the long acting, and you don't get all the side effects.
You don't get all the side effects.
Yeah.
I've had very few guys have any negative side effects from it, and even usually what they're asking is, can you increase the dose?
No. Need a little bit more.
That was great, but I think it can be better.
Right? More is always better. More is always better.
You guys are always asking for more.
Yeah.
Right.
That sounds like us, but I mean, I would even say this.
And they'll be asking for more time in the day.
Exactly.
That's the only other thing you need.
From my perspective, and again, I guess really not being the one to ever conversate about it or anything, I would think for any guy, if he was truly suffering from it all the time and going through it, and he does finally, get rid of his pride, ego, whatever it is, and just goes to see a physician of some sort, my only answer that I would have thought and assumed was just Viagra. I didn't even know about a lot of these other options until I started working with you.
For a lot of traditional doctors, that may be the only answer you get. Yes,
I would imagine so, because I have been in doctors' offices before, even in younger days, but never heard any one of these terms, as far as games wave or anything else that you would be looking at. And that's what I just thought, common, just general knowledge. For me, only thing I knew is that if it wasn't getting up, you can go get a Viagra pill, and that if it lasts for longer than 4 hours, you need to go to the doctor because your heart might explode, okay? That's it.
So no, your heart won't explode. You might not ever get erections again.
Okay, maybe, I don't know. It's broken forever then. I don't know. But
that's funny. So if they not getting up, here's the pill, don't take too much of the pill.
Pretty much,
or if you have too many,
yeah.
And in between that it's not only is it not getting up, is it taking you longer to get up, is it taking you longer to orgasm,
where's the sensitivity, are you happy with your
premature, ejaculation. There's
That's
all
it. We didn't talk about that. Sometimes it's premature. It's happening too fast. My partner's not getting off. What do I do?
Oh, that was just excitement. You're ready to get to that high five at the end. Real
when
quick,
it's consistently like that over and over again.
That's all you can do is high five yourself. That's a problem.
Fair enough. Good job, me.
But the woman's gonna sit there and go, "What about me? Hello?"
You can't leave them behind.
High five, please. Okay.
You can't leave the ladies behind at all.
That's not a good look.
No, they ain't gonna stay with you.
A couple times they might be like, okay, look how he was just so turned on, but then
I'm so amazing.
Yeah,
and then it's like, screw this.
Yeah, exactly.
Fair enough. See, I
I'm
didn't
not
even know
that again.
Yeah. Done.
Busy Saturday.
Yeah.
I'm real busy.
What are you doing? Anything but you.
Right. Literally everything but you.
Literally.
Yeah.
I had no idea even on that aspect. That's just it. I mean, if we didn't seek this information, I don't think it's going to be taught to us on a regular basis. And not that that's anyone's fault but your own, of course. Obviously, look up, see that there's other answers out there. But I think we just have like movies that have always shown us Viagra pills and the guys getting stuck with advertisements, commercials, to even like now, if you go on stuff like TikTok, right? There's this trend going on about these. You probably have seen it or heard about it, at least the ashwagandha supplement. Ashwagandha. People are talking about how it can increase the penis size and that it helps out your sexual, I guess, performance as well. So people are just like, oh, well then that's my new pill instead of a Viagra pill, you know?
So it's interesting because again, that's like an adrenal support. So when we're talking about hormones, not that this is that what you're saying is valid. I don't know. I haven't seen it.
All I've ever heard about that is with stress and cortisol. And it's been known to help lower cortisol levels, which plays into this pathway.
Yeah. So the hormone aspect is a big and comprehensive. It's not just testosterone. That's one of them. But thyroid can be an issue. There's all the metabolites and the conversions. What else is testosterone doing? Is it going to DHT, estradiol? You know, how much is free? How much is being bound? But cortisol, so ashwagandha is a adaptogen. So an adaptogen just really helps the adrenal gland kind of support it where it's at. So it can be low or it can be high, but either one of those can affect erectile changes. And so that wouldn't be my
go-to supplement by any means.
No.
I've got a whole list of other things I would do 10 times prior.
Yes, absolutely. And again, you know, they have to just comprehensively be checked. You have to have all those data points. So like you need to know if the cortisol or whether how stressed they are. And see, I didn't even know that was a new trend.
It's going on around there.
You know what? That's funny because somebody asked me about that. And I was like, okay, let's talk about this pathway. Let's talk about pregnenolone. Let's talk about DHEA. Let's go all the way down and kind of talk through that. I'd hit all these points first before I went anywhere near that. Unless, you know, like you said, it does support the adrenal glands, but that wouldn't have been a go-to.
That would not have
It's one of those things. It's just, it's talked about so much and it's gone viral, if you will, on there. So people are going to just use, that's got to be it. Yeah, TikTok's my new doctor now. So that's what it's got to be to fix the issue.
Dr. Google, Dr. TikTok.
It's better than Google. At least someone's talking to you.
Yeah, that's just it. I guess Google had to read everything. Now it's TikTok. I can watch some guy that...
They're just giving you all the information, whether it's correct or not.
He's probably got no experience in this at all. You know, he's probably half dead, but he's taking it, so it's working.
People like to learn when people are talking to him. Yes, so TikTok's it. Well, I think that's the big issue is that a lot of men, so like, again, they've done studies, you know, where they ask men questions and they answer and shows that they have erectile dysfunction or changes again. Yet most of those men, like 71% of them, don't know they have it because they didn't know that it wasn't just that you couldn't get it up, that the erection was an issue, but there's other issues. And so as you ask those questions, yes, they have it based on their answers, but no, they didn't even know they had it. And then likewise, just a small percent of those are actually doing something about it. And so there's a huge, subset, you know, of men with some changes that can be helped that don't even know they really have it or that there's solutions out there. So that's what this is all about.
Exactly.
Is so that we can have those conversations and get the word out and allow you men to ask questions and women too if you have a partner that's having issues and you have questions, and because we have a lot of women that bring their men in, and so
or make them appointments.
Yeah.
You gotta go see them today.
You know, I'll have guys say, you know, I'll talk to them about their shim scoring, and they'll say, well, what is on there? She actually filled that out. Can I see that? I'm like, ooh, let's talk about that. Yes. You know, and he's like, dang, that's where she rated me. I'm like, okay. Yeah. I'm like, is it true? He's like, I guess I should be fair and say yes.
Exactly. So, but I mean, women want their men.
Women are proactive about it. Their own health and men's.
Well, clearly, we'll talk about what's going on where we don't. We try to ignore it, I guess, until it's obviously in front of our face, and then we'll maybe go do something about it. Like you said, they may know what's going on, they're still ignoring it, but that's just it.
So much more than just a pill.
Yeah. And again, you can do. I mean, if you have changes at a younger age, there's lots of things we can do that aren't that complex, you know, because it's more mild. And so if we're optimizing your hormones and we get you on some supplements it may be enough for a very young person that has it. And then otherwise, if we don't see some changes, then we can actually go a little further into that, exploration into why, or we can start other treatments. And so there's just a ton. We talked about the trachea and underneath the tongue and the combination. There's peptides that we can use.
PT141.
Yeah, and that works a different way because the Cialis and Viagra, the little blue pills or our compounded pills, actually are increasing blood flow and vasodilating and increasing blood flow to the penis. So that's more of a local treatment where PT141 works centrally in a different way. And so that's another way. Almost all people, by the way, and we'll do a podcast on PT141, love PT141 at some point. Just when is the question.
Yeah.
And so because, again, it increases erections. They can get spontaneous erections, brings their confidence back because they weren't having them. And so even if we're doing treatments, PT141 is something you could potentially use to get them erections back.
Orgasm strength.
Yes. So even if it's not just erections and increasing,
and it's
orgasmic strength is huge. So even couples that want to kind of try something different,
enhance their current situation.
Enhance their sex life. This is a peptide that you can use. IV therapy.
Oh, yeah.
Because amino acids play a big role in all of this. And so we do IV therapy and put amino acids in the IVs and, and again, supplements and DHA and
aminolone and supporting that pathway. Absolutely.
I don't think I could go into a walk-in clinic anywhere and be told about any of this at all.
No.
Like that's just not going to happen.
No.
Well, and I think that is the other issue is like with wellness, functional medicine, integrative, sexual medicine, it's actually patients being more proactive than providers sometimes and physicians in traditional medicine. So they're seeking answers on their own.
Yes.
And so finding an office that is a place you trust, that's comprehensive, that is getting you results, it's not a one and done. It's a journey. Traditional medicine's a one and done. Like we'll see you every 6 months and you're going to get very specific answers. The time isn't going to be, it's not that they don't want to, it's not set up for them to have the time because it's insurance dictated most of the time.
Yeah.
So
absolutely. Traditionally you're fixing illness, right? Your problem, you're fixing the problem. You're not fixing the problem. You're looking at a problem going here's a Band-Aid, right? You're coming in, this is the issue, and you're just focusing on that one thing, throwing some med at it, out the door, because you've got 10 more people behind waiting in the waiting room.
Yeah, absolutely.
You're just kind of going through. In the wellness realm, people are, like Dr. Durst said, they're seeking that information. I love it when patients come in and they're like, I'm here because I have read about GainsWave, I've read about PRP, into the penis, of the P shot, and I've read about PT141. Like they've already have taken those steps to educate themselves, or they're saying, hey, I'm taking these supplements and I'm starting to feel a little bit better because, I know that they help with certain things, but what am I missing? What else is going on? I want to feel better, right? I'm looking for better quality of life all around. I'm looking for overall wellness. So I think in our realm that we do, in the clinic that we're in and the people we're seeing and the patients we're seeing, they are a lot more proactive and they're looking to enhance and optimize, and they're not wanting a medication thrown at them, right? They're wanting to actually figure out what's causing it, what is the root of this, how do we fix it, and how do we actually make real changes in the body to prevent it from happening again. And that's key.
Definitely wellness. Like they want to prevent, they want to fix the underlying problem. They don't want it to progress, and again, it's not a one and done. It's more comprehensive. The treatments can vary depending completely on what you're experiencing. And it's a journey. You're going to get to know Faraday and myself for sure, and
absolutely.
the entire
and then we might be pulling Marissa in too.
Yeah. And then the entire office, and then the office is going to get to know them too. And so along the way, it's education. Education is huge. We don't talk about all of this on the first visit. we're
And you
only
might not
talking
need all of
about
Yeah.
you might not need all of it. It's geared and focused on what your primary, solution, like what you're looking for, the results you're looking for. And then as you're getting treatments or services or visits in the office, then we'll talk about things as it comes up or as it seems appropriate. And so it's a journey, which is what we love. We love to get to know our patients. So
I know that's evident for sure. You guys always do. I guess even from a man's standpoint, that I just think in the way we think, and we can be very singular at times. I don't know. That was probably not even the right word, but I don't know. When I hear journey, I guess a curious question that comes to my mind is like, how long are we talking about?
Well, we can give you the combo pill in the meantime, right? As we're
Yeah.
working on actual changes, right? So GainsWave, we're using the acoustic shock. We're trying to improve and repair damage, right? So we're trying to increase blood flow, not just locally, like with a pill, right? It does it. It works for you. That's great. But then next time you got to take a pill again.
Same thing.
Right. So we can prescribe and we can work with you and for that immediate gratification that you're talking about. But the journey is overall change to fix the problem, right? That's the goal, is that doesn't keep happening, right? Make those changes to last. But yes, for the immediate gratification, we can send you home with some combo troches.
That's how we think sometimes.
I can send you home with some combo troches.
Trying to get in, get out. That's it. That's what
well,
I think
and then
sometimes.
also I think taking that further, I think you mean like how long is it gonna, like how you're not in the office long for any one treatment.
Yeah.
Even if we're doing a P shot and a GainsWave combination and you've talked with Faraday or myself, we're talking about an hour. Sometimes it's 30 minutes. That can take 3 weeks to perform, could take 2 weeks to perform. It could take 3 months. It depends on how many you're getting.
Sure.
And likewise, again, I say every single touch point is like with regenerative. So GainsWave or P-Shot is a 3 weeks to 3 months. So you're going to start to see improvement almost, every touch point, and then it just gets better. But yeah, you'll get an immediate. So our goal is we want healthy blood flow in when we're doing our regenerative procedures. So we want you to get erections. So again, it's very rare that you'll ever hear, and I can't remember I think maybe there was a PSA elevated once.
Oh, yeah.
And we needed to see that go down before we could address the hormones. And I think that was the one time I said to somebody, before we test your testosterone next time, don't have sex, don't ride your bike, blah, blah, blah. And it was like, you're recommending me not have sex?
Right.
Because usually we're like, have all the sex. Have all the sex. All that you want.
I've never heard that come out of your mouth. Because usually we're recommending, again, the more sex you have, the better blood flow and the better regeneration. So that's what we're about. It's like
quality over quantity. I love it.
I like it.
Quality over quantity. For some, it might be quantity, whatever they want, right?
They're going to be asking for more time.
Unless we're trying to high five ourselves, right?
What else can we do?
Exactly. So
That's fair enough, though. I like it because you do have a fantastic office, no matter what. And I think again, going back to just as men, we just think so straight line most of the time, right? To know those types of time frames, to even know if it was GainsWave 3. You say 3 weeks to
we can complete
to 3 to 4 months.
Yeah,
right?
but just to know that though.
Yeah.
Because again, my only knowledge about this outside is just get a little blue pill and I'm fixed. I'm good to go.
You'll get your blue pill. Don't you worry.
Just that 4 hours. Faraday said my heart won't explode. Okay.
It won't explode.
Yeah, just remember that.
No, it won't explode. And again, those are low doses, which are really actually great for anti-aging, anti-inflammatory effects. So all of that. So not only are you not getting the side effects, but you're increasing your overall health with low dose of those medications. And so we use it in women. We use it on a daily basis sometimes. So it's not just
women
for erections,
can use it as well.
Yeah,
Most women don't realize that they can have low dose
and their heart
Cialis.
will not explode either.
And they love
Nobody's
it.
heart is exploding. That makes me feel good. But I swear I saw that in a movie somewhere. Somebody who said your heart will
Movie.
explode. Yes, that's my trusted
TikTok?
source. Yeah,
It was
maybe,
TikTok.
Maybe it was. I don't know.
I think I know
Might
maybe
be.
who on
It
TikTok.
might be. Yeah. I think
watching
we
too.
don't. We know
We won't.
specific.
Yeah.
Person there.
Well, I think again we'll do more. We're going to do another podcast, and we'll talk more about hormone optimization, some supplements we use. We want to do another PT141. Please comment and leave us your experience with P shots, GainsWave, hormonal optimization in your doctors or in the cities that you're treated, whatever. And again, we do remote patients. And so if ever you felt comfortable with an office, the important thing is to find somebody that you really trust, the office, the entire environment, the results, all that. But leave us a comment, subscribe, like, share. Remember, sharing is caring. You should share this one with your friends since you may not want to have that conversation. And again, we're here to revitalize your look, your health, and your sex life. Thank you.